Signs and symptoms of brain tumors and what to do. Having a brain tumor is perhaps one of the most dreaded diagnoses as it puts one at serious health risks. A brain tumor is also referred to as an intracranial tumor. It is an abnormal mass of tissue in which cells grow and start multiplying uncontrollably. There are various types of brain tumors, both malignant and benign. If dealt with in the early stages, most brain tumor patients have high survival rates. However, the tumors, like brain cancers, can be severely debilitating and may prove to be fatal. Headaches are amongst the most common symptoms experienced by people with a brain tumor. The tumor-related headaches are usually severe and intensify with activity. They are worse at night or early in the morning. These headaches occur when the tumor is big enough to push on the nerves or vessels nearby. Tumor-related headaches are often described as dull pressure-type headaches. However, some patients report having stabbing pain in their head. Seizures are a common feature of brain tumors. They are involuntary and sudden contractions of the muscles. The imbalance of chemicals in the brain due to a brain tumor development may be the culprit behind seizures. They may also be related to the abnormally growing cells altering the brain's electoral activity and affecting its optimal functioning. Seizures often vary in types and may be followed by a loss of consciousness and altered sensation. People having a brain tumor may undergo personality changes. Exaggerated emotional responses and unexplained mood swings often indicate an underlying problem. Each part of your brain performs different functions. The frontal lobe of your brain is responsible for shaping your personality and managing your emotions. A brain tumor in this lobe alters its normal functioning, and you experience personality shifts and usual emotional responses. While some people are forgetful from time to time, obvious memory problems that disrupt everyday activities may occur due to some underlying issues, and brain tumors are one of them. The memory loss linked with a brain tumor is much more than simply forgetting your wallet at home. The signs of memory loss associated with tumors include forgetting names of simple and everyday objects like pen and cup. Asking the same questions repeatedly also indicates memory issues. Memory problems are common in the frontal or temporal lobe tumors because these areas are responsible for forming your memory and recognition. Speech problems or aphasia is the most common communication problem experienced by people with a brain tumor. The brain has two areas responsible for speech production and comprehension, known as Broca's and Wernicke's area. Tumors in these areas may result in impaired language and the inability to speak or comprehend words. These issues are also followed by reduced ability to read or write to brain damage. Brain tumors are also responsible for altering the decision-making and judgment abilities of their patients. Your brain is wired in a unique way that allows you to reason and participate in complex decision-making activities. However, brain tumors disrupt the normal functioning of the brain, damage the surrounding cells, and alter chemical levels, consequently affecting the decision-making abilities one possesses. Balance problems might be an indication of a brain tumor. The cerebellum is present at the back and lower sides of the brain. It is responsible for the balance and coordination of both simple and complex movements you perform in daily life. From chewing and swallowing to walking and running, the cerebellum coordinates it all. Damage to this area due to a brain tumor causes trouble walking because the legs and their muscles are unable to coordinate efficiently. Maintain balance, synchronizing eye movements, and performing fine skills like sewing, knitting, and painting may also be affected. The brain allows you to sense and feel pain, pressures, fragrances, and textures. You feel them all and differentiate between them with the help of your brain. The parietal lobe lies in the middle of the brain and is responsible for processing information related to temperature, pain, taste, and touch. The occipital lobe at the back is responsible for your vision. Brain tumors in these areas can cause damage to the surrounding tissue and alter your senses. Several tests help to identify and diagnose a brain tumor. Your doctor may consider your signs and symptoms, suspected tumor type, age, general health, and earlier medical tests to determine a diagnostic test for you. Most brain tumors are not diagnosed until the symptoms appear. In general, the diagnostic procedure for a brain tumor begins with an MRI. MRIs give a clear picture of the tumor and its location. They use a contrast dye to provide clear images. CT scans, PET scans, and cerebral angiograms are also used for imaging purposes. Your doctor may recommend a myelogram to find whether the tumor has spread to the spinal fluid or not. Neurocognitive assessment plays an essential role in evaluating the brain's significant functions like memory, language, skill, and overall well-being. Once the type and stage of the tumor are detected, the treatment begins. Medications for seizures and reducing brain swelling are administered. Tumors are usually removed by surgical procedures. However, not all tumors can be removed through surgery. Radiation therapy and chemotherapy also play an essential role in destroying the remaining tumor cells. Though there is no way to prevent brain tumors for sure, you can reduce your chances of developing one. Adopting a healthy lifestyle is the best solution to keep yourself fit and disease-free. Avoiding smoking also reduces the risk of developing cancerous tumors. If you have a brain tumor, you're likely to face some side effects. Don't forget to report them to your healthcare providers. Besides physical side effects, brain tumor treatment may strain you emotionally and socially as well. Seeking psychological support and joining support groups allows you to communicate your emotions and connect with people on a similar journey. If you're a family member or caregiver to someone diagnosed with a brain tumor, know that the patient requires emotional support besides physical assistance to overcome their health-related challenges.